Hi again everyone, it's Sasha. In this video what I'm going to do is chronicle my whole experience with endometriosis. I've had endometriosis from the onset of menstruation. I've always had pain with my period. But it's for the most part been manageable. Like Panadols, normal stuff you would take for pain didn't work. So I just got into the habit of kind of just toughing it out. And then I had a strangulated hernia. And this is where the story gets good. I was born with an umbilical hernia. It wouldn't hurt at any other time unless someone poked me in my tummy, in my navel. I had a strangulated hernia somewhere at the end of 2009. I had the hernia repaired in January 2010, and that was the beginning of the end. I found out I was anemic when I was getting blood workups done for the hernia repair. After the hernia repair, I had a case of cellulitis, which is an infection in the skin, the area of a cut or whatever. After that, I had this horrible case of paresthesia on the entire left side of my body that lasted for about a week, and paresthesia is basically numbness. Then a couple months after that, I had my first ovarian cyst rupture. They labeled it a hemorrhagic cyst, which is basically when you bleed out inside of the cyst, and that bleeding causes tension within these cysts in the ovary, and it ruptures. So I went back to my doctor and she just told me, that this can sometimes happen, but if I have any other pain, just to come back to her. This was my GP. I hadn't seen a gynecologist up until this point. That's when I started to have the pain in my left side, my left leg. I realized my foot would feel really, really heavy. I would have to literally hold it and lift it up sometimes to get it to move. I started having to walk every single day with an umbrella because I couldn't really walk properly on my foot because of the numbness and all the weird pain that was going on in the side of my foot. And a couple months after that, I had a second ovarian cyst rupture in the right ovary this time. And realized in the weeks, like the week after, the pain did not go away the way it normally does. The pain refused to go away, and along with that pain, I was having some serious problems with lightheadedness. I couldn't walk. I would have to hold on to the wall. So after I think 2 weeks, I decided to go to the accident emergency because the pain wasn't going away. But I was more concerned about the lightheadedness because I read you can bleed out from having a hemorrhagic cyst. I was worried I was bleeding internally and I was going to just drop down and die. Went to accident emergency, and they admitted me. That was my first time being admitted to hospital. That was when I got my diagnosis. The morning after I was hospitalized, they took me down to ultrasound. The doctor, he had the other students with him, so he was pointing out to them where the cyst was. And also, because I had left my ultrasound report at my doctor, I didn't think I would need it again. Never, if you pay for your ultrasound reports, never leave them anywhere. Always keep your ultrasound reports with you. He told me about polycystic ovarian syndrome at that time as well, that my ovaries were polycystic. And then he said, well, you're having cyst rupture, but the cyst is not the problem. You have endometriosis. So I heard that, but during my research for ovarian cysts, we research everything once we hear we've got something from the doctor. I saw nothing about endometriosis, so I did not link the two together when he said it. So I asked again, okay, so what's causing the cyst again? He said endometriosis. You have endometriosis. The cysts are a symptom of endometriosis. The cyst in itself is not the problem. And I didn't even believe him. It didn't make any sense because it wasn't like anything that I read. Anyway, I stayed in the hospital for, they had me on Voltaren. Did nothing at all. And the pain got worse and worse up until my menstrual cycle. When my period started, that was maybe after 4 days in the hospital. I started to feel so much better. So he came in that morning and was like, I'm feeling better. My period started, was like, good, okay. Right, so, and he was just explaining to the others, you see, definitely this is what happens sometimes with endometriosis. I discharged that same day, and it was okay for the first couple hours of bleeding, and then the pain started up again really bad. And I'm in there like, I still want to go home, and I buckled over on the bed. And the nurse came in and she saw, and she was like, you're not feeling well? And she brought another Voltaren for me. The Voltaren never really worked. So I went to the hospital, and after that second cyst is really when everything just catapulted. Things just went rolling from there. I went home from the hospital, and around day 12 of my cycle, the pain started up again. I will never forget how like scared and confused I was. And I'm thinking, this is for the rest of my life. It's supposed to be like this for the rest of my life. I couldn't really quite. I was really scared, and pain again catapulted. Continued to get worse from day 12, and exactly 1 month after I had my second cyst rupture that put me in the hospital, I had another cyst rupture. This time around, I didn't go back to the doctor. Just after that, I went back to see the doctors at the hospital. They put me on, first they started me on, when I was hospitalized, they gave me a prescription for naproxen. So I was on naproxen, which is a generic version of Aleve. So that didn't work at all. I was up to like 1,200 a day, which I think is the max. You're not supposed to do that because it can rip holes in your stomach. Those kind of anti-inflammatory meds. So I went back, and I'm telling the doctor the pain medications, they're not working. It's not doing anything. It's difficult for me to get to work, and blah blah blah. She had me, well, she put me on the birth control pill. The birth control pill worked the first month, and after that things got fun. This was around January 2012 now. The second month on the birth control pill, it was like my body went like, Sasha, seriously? Of all the things that you can try a birth control pill. The pain literally got 3 times worse. And yeah, birth control pill. I went back to see my gynecologist, and I explained to them around that time one of the problems I was having was that I could not sit. I don't know if it's obvious from the way that I'm sitting now. This isn't just me sitting this way for comfort. I tend not to sit flat. I always lean on one side or the other because it's still painful now. But before, it was extraordinary. I wouldn't be able to even sit and lean like this. Anything at all that caused my body to bend forward any kind of degree was pain that it was bad. Imagine not being able to sit at all. It was horrible. Especially I was working, I would have to stand at work for the entire day. So I went back to them and I explained to them what was going on, and it was a lot, and they decided to do the surgery. My surgery was scheduled. I went to do for the surgery, and I couldn't have it because I had pharyngitis, I think you guys said. So they couldn't do the surgery. I begged, but I did not know that did you know they put tubes in your throat when you're having this laparoscopic surgery? I didn't know that. So they couldn't do it the first time, but they put me on northisterone. The northisterone started to help at first. Then I went and got the lap done. 12 hours after I got it done, the medication worked its way out of my system. Woohoo! Man, I was in here crawling out on the ground. I literally had to put my bed on the ground for like a week. And I would literally crawl off the bed to like crawl to the bathroom and come back, and it was not fun times. So I went back, and he explained to me that my endometriosis was stage 2, and explained the options. So he asked me about Depo-Provera. Just wasn't keen on the injections, I think. So I decided to continue on the northisterone, and by that time he had to up the dosage because the northisterone had started, my body started to relapse again, much like it did with the birth control pill. The northisterone worked for 1 month, then after that it didn't, and I had problems with northisterone where I think sometimes it would make the pain worse. I would take the northisterone, and like half hour after, the pain would get really, really bad. So I would stop taking it, which is bad because you stop taking it, you start to bleed. So I go back on it to stop the bleeding. The bleeding stops after maybe like a week, 2 weeks, something like that. Then the pain again with the problems with northisterone. It was a really messed up kind of situation. So it got to one point where I couldn't take it anymore. I couldn't take. I was at work one day and I had a flare. That morning I took, well, it was a 50 tramadol, 4 Panadols, and 1,000 naproxen. And when I got to work, I had to take another 50 tramadol. By 12 o'clock, I couldn't function. There's a doctor who works downstairs in the building where I work, so I went to her. She gave me a shot of cataflam injection, IM, in my butt. I at that point in time, she discussed with me using Depo-Provera, and I was like, yes. Desperation at that time, so I'm like, yes, I'm gonna try anything to get this problem under control. So she gave me a shot of Depo as well at that time, and the Cataflam didn't work. So she also gave me a Celebrex. She told me, okay, she told me to just sit and see if the Cataflam would kick in. I guess it usually kicks in really quickly, I guess, and it didn't. So she gave me a Celebrex tablet, which they took maybe like 2 hours before the pain started to maybe kind of start to like go away a little. And you know, I called my mom and she's like, sure. And even the doctor asked, you're going home. So I'm like, no, I can try to, you know, last up the day. It was a bad day. I really should have gone home, because that evening, by the time I got home, thankfully I got a ride home. By the time I got home, I was no use to myself at all. It was, so I got a prescription for Tramadol, and I got my cousin who's a pharmacist to bring it for me, completely forgetting that I had taken 100 Tramadol already during the day. I took 300 Tramadol that evening. The doctor downstairs referred me to a gynecologist who's close to where we are, and he had told me that I had severe inflammation in, was it my uterus and my ovaries, something like that. So I explained to any painkillers I was taking wouldn't work, and he just looked at me and said, well, do whatever you have to control the pain. Well, doctor says that, but I guess he knows what it's like dealing with endometriosis. So with that in mind, I remember one time before I had to take 300 Tramadol to help with the pain, and it was that bad that night. It was, and I took 300 Tramadol. And the next morning, I woke up, could not control my body, stumbling through the walkway, falling asleep, standing up. My whole entire body was like a mess. I went back to the doctor, and she told me that I had overdosed on pain medication. Bad move. And that was also the day before that, the Friday before that is when I was really ill. That was the last day that I worked as well. And that is a story for another time. Put yourself first at all times. When it comes to your health, you have to look out for yourself first. Nobody else is going to do it. Nobody else can do it. Moving on from that, what happened after that? Aha! The Depo-Provera started bleeding maybe a couple days after I started the Depo-Provera, and I bled for 30 days before I decided it was time to go to the hospital. Because the bleeding wouldn't stop, and the bleeding causes pain, of course. So imagine bleeding for 30 days. With endometriosis, 5 times! And so I went to the hospital. They admitted me, put me back on Northisterone to control the bleeding, and at that time I was hospitalized for 2 weeks. That was a rough time. I wanted to go home, but they actually refused to let me go home. Figured I'd be back there pretty soon. So after 2 weeks in the hospital, I left, and while I was in the hospital as well, I started having problems in my left hand, like right here. I had something called, I found out later, the queer veins, tenosynovitis. But what happens is the tendon sheath, not the actual tendon, the sheath that protects the tendon and the tendon runs through, gets swollen,